my original personal email.
proposal.
So,
Oh,
like,
okay. And then
the email that used to
hopefully
be my
the
professional
actual.
email. Like I
Oh,
started
yeah.
using it.
So I've been, sorry, I was going through a lot of like,
I see
changing things and reframing
and
things.
like a whole, even like
like,
I saw like
I-
a paperback.
I
Like,
like
you know,
to my advisor.
Sure.
Hopefully he likes it.
Yeah.
It's always just like,
So I have a friend who's like in grad, like she's in her second year, but she's like kind of speed running the program because she's doing. Like,
Okay, I mean,
so she's just like after I got more.
oh, this
And so she usually we have her
wanna
grad
not
class
be able
next
to
year,
start
doing it
reading
this
till
year, and she's
Saturday.
just like, make sure
Wait,
you
this
guys
is also my
send it, and
fault
I
for,
get to
like,
go and get comments back, and I'm just like, please, please
But
be
I
okay
think
with
being
it.
more better use
It-
on Amazon.
Okay.
I don't know. I think that what happened is in my meetings, like I'll be like, yeah, I think this. And then she'll be like, why do you think that?
Oh, I
Like,
see.
Should I not?
no, right. And so then I'm
I was
rethinking
thinking how much-
my entire on this earth. And then she's like,
And I was just like, no, like, why do you think that? Just let me know. And then you're just like, oh, it was not true.
and then she's like, sounds like something else. And then like,
Oh, I see.
on that.
I can get
and then
this
it's
one
me,
for 17 for
then
this.
it's me rethinking
could
my
get
entire
it.
being. She's like, you're in a good place. You can continue to move on. And I was like, oh, hey.
Yeah.
Like you're eating me.
It's like a telescope.
All you have to do
It's
is-
not-
Yeah.
Yeah.
17 is the next one.
Initially, I was like,
Oh, I don't like treating you. It doesn't, you know, it's like,
and then I think I was
it must be like individual essays.
Cheers stuff.
Oh, should I do
that?
Well, it's a good time not to be doing that, correct?
Oh, I know. I mean,
Really great. And I was like, homegirl, just
it's not cheering. So maybe it's I get something.
I know, right? Like, we love that, but like, and so it's like, adolescents.
Yeah, so it's this whole one, I guess. But then these three, maybe, so these look like they're. Yeah,
Like
like
social
something.
records and
I guess.
because I think
Oh, she might-
check
No,
the
these
page.
Why? This is from this.
Yeah, like.
I mean,
Relative. So.
Yeah. There's that, but. I also went.
So it's like, okay, like maybe it's like Saturday, like putting off the time.
Yeah.
It's
So, all of that.
Should be printed.
Okay, maybe I'll just order it.
So we are.
I really hope that I get good stuff.
Yeah.
With her on Wednesday, I wanted to update my.
Okay.
Just make sure you can change, because.
That's the one I think I don't know. Here.
So glad you're here.
It's been
It's fire. Yeah.
About like.
But I feel like we have pretty. I mean,
Okay, like good.
Yeah.
Maddie had asked me like if he was like, I'm not sure about these numbers, can you let me know? And then she's checking for you and they know different things and.
So G data. So measuring.
Like that, I was just kind of scanning and I like, you were like. Yeah. Far, it's just like, oh, so good. I think.
Like, my advisor really focuses on terrorism as
The one,
right,
the one
and
progressive.
then we also have.
189 pages.
Yeah.
I do it so well. I do.
Yeah.
But I'm, so I'm like.
Let me actually open it.
Was it discipline and punish like?
To do like,
Yeah.
try to LinkedIn, like neighborhood.
And
Like,
I was on the phone.
things that compile with.
How many pages are those?
And I don't wanna like.
You know, what, it's up like.
Well, one, yes, that also.
It was
like,
like
kind of
accepted
like,
thin.
I think
Kind
one
of.
thing is like, I think
Do you need an outlet? Please spend more after. It's probably or whatever it is.
Especially with that
My
frame,
notes say,
like that flower.
even though this one originally was written.
The way that they were.
Like,
Sorry.
Are you on the coast? Is that?
We're on. Yeah, be like a.
Oh, yes.
Yeah, we're on a real.
Where is this stage? I feel like it's more like.
Sort of Lisa.
Like, it's just space.
You are different. I do.
But.
I usually say, I'm Carolina. Yeah. Well, I've been prepared like that when I hear my hair on and alternate gray. It's like, Geneva's a former student. It's like, being like, hey, you know, like, yeah. Good. I'm really good. I was telling Lisa, I saw she was Claire. I'm just you. I have seen Claire recently at the ballet. Oh, is that right? My interest.
Realize.
In that party. Yeah. It's a party, retirement party.
And like kind of, which I think is something that's like not maybe the main purpose, but I think it's even cool, like, could we have
Okay, so it's actually.
the participants or their neighborhood office.
Yeah.
And we don't need it anymore.
Perfect.
Information, like
And I probably
what,
worry.
admin.
Maybe I can do the
would be
$5
versus what direction it's going to go. So that.
Very much so. Yeah, I mean, I with some input. Yeah, it really was. Was that like
Helpful because I do not
so I can
love being in church late and then talking about it also.
I know.
Yeah. It's short.
Because we're flat.
I'm like shorter than
A lot.
the notes for.
That would wear the.
So I think we could just, things be good.
Yeah.
Yeah, I just kind of know what to expect.
Yeah, this is like writing with your child, but I'm
Yeah.
not. Yeah, sure.
Yeah, you just.
It says you were sitting in your office this morning as I.
I feel that kind of issues when I love these shoes and I think it's a very best read. And I put them in England.
Sorry, don't borrow.
It makes it even better.
It's kind of dark in my head.
I love that. This is usually.
Yeah, this one in my cohort. And Lisa, sorry, Lisa is an extra. I love your shirt. Yeah, we were just talking about.
And also. Yeah.
And I was like, that guy, which.
We do. We really do.
No, when I saw mine. After I got rid of it, and then when I stopped dying, I said, "Wow, right."
Why does Sarah talk to you about?
How are you enjoying life?
She's did it, but she didn't.
Yeah, I'm.
Exactly. They will be like, answers.
Yeah, I mean.
Interesting.
Yes. Mixing it.
It's gonna be loud. It's gonna be loud.
Hey, why didn't you get
starting for the seminar. So, hello everyone. It's my distinct pleasure to introduce Lisa Pearce today. Lisa is professor and chair of the Department of Sociology, as well as a longstanding CPC fellow. And Lisa's research focuses on family dynamics and religion and how those shape beliefs and behaviors across the life course. In the past, mostly in adolescence and adulthood, but moving to a new life period here. And her work has focused mostly in the US and Nepal. She has two current projects that examine this project that we'll hear about today, family relationships during pregnancy and how that impacts maternal and child health. And then also how race and racism are constructed in the US megachurches since the wake of George Floyd's murder. And I think what's really distinct about Lisa's research is her combination of qualitative and quantitative methods. That she's a real leader in the field for qualitative methods and how she incorporates that into lots of highly visible research, including, I was looking at her CV today. I've known Lisa for a long time, and I didn't realize how many books she's written because she always mentions writing a book. And I was just thinking, oh, she's working on the same one for a long time. Lots and lots of them, along with all of her high impact scholarship and journals as well. So it's a distinct pleasure to welcome Lisa and hear about her work today.
Thank you. Thanks everyone for being here. I'm excited to present today because these are new data and that's really exciting and overwhelming. And but presenting has helped me work on some of my ideas, and I also believe it will lead to good questions and comments at the end from you all to help me think more about this. So thanks for being here. And I just want to acknowledge my co-authors on this developing paper and some related papers. Dana Haney at Ohio State, who is a social networks expert. And then Jenna Wershing is here today, and Caitlin Joshua couldn't be here, but they're graduate students in sociology, and they were very instrumental from day one of this project, helping with the design and the development of our data collection instruments and so on. We'll hear a little more about that. And Amanda, who introduced me, is a co-investigator on the project as well. So let me get started. Just an overview of what I want to do today is first, to kind of think about theoretical and methodological motivations for this new project of mine, the Family Matters study. And so that sort of larger project, but then also focusing in on some results today that think about how family dynamics or characteristics are related to prenatal mental health. So we'll look at a few results towards the end about that. So many of us here at CPC generally are interested in this sort of connection between family context and the health of an individual. That could be both family context shaping individuals' health, or it could be run the other direction. There are things about people's health that influence the operation of a family. And when we talk about family context as family demographers or sociologists, we're often thinking about family structure, who's in the family and what kinds of formulations do we have. And also often our theories and our measures are trying to capture something about family support and kind of positive elements of families or family stress. And these can be potentially negative, harmful dynamics in a family. And often when we're trying to look at family, some of us tend to feel limitations around what is in our typical data sets when we look at family and relationships to other aspects of individual well-being. And I'm sure many in the room are familiar with these kinds of limitations and frustrations. I'm just going to share a few quotes here from, these all come from decadal reviews in Journal of Marriage and Family. So on each decade, they do a special issue. And the last two included reviews on the literature on families and health. So that's Carr and Springer 2010 and Umberson and Tamir 2020. And Furstenberg wrote a review that addresses work on extended families and how extended family members are involved in family life. So Carr and Springer in 2010 give sort of the most detailed critique, but they're saying, you know, one of the most ironic limitations of studies on families and health is that most focus on one individual within the larger family network. So they even call it a network. This limitation is due in part to traditional models of data collection. They fail to capture the complexities of family life. It's a word that comes out a lot, complexities. And then if we look at Umberson and Tomir, similar but shorter sort of family and health studies will benefit from more studies that include multiple family members. And Furstenberg saying the sheer difficulty of collecting detailed data on relations within extended kin has led to an underestimation of their significance in the everyday life of families in the US. So what we're trying to do is say, given these limitations that people have been talking about for a long time and the kinds of data that we use, especially in surveys, what can we do to improve on that? And here's a slide where I'm thinking at the same time, kind of moving through time about theoretical and methodological developments. So if we think about theory above the squiggly arrow, I'm drawn a lot to some very early work. In 1926, Ernest Burgess published a paper, I believe it was actually an address he gave, titled Unity of Families as Unity of Interacting Personalities. And he was very interested in, it was a kind of a critique on family structure kinds of approaches to say, it's not just who's in a family or a household, but how do they interact with each other and what do those ties look like? But his work is coinciding with this, you know, strong program of structural functionalism in sociology and attention to nuclear family structure in social science in general, in terms of looking at families. And I would say a lot of that has to do with the rise of the social survey and just what are the limitations then when you're trying to collect data through a survey. Turns out it's simpler if you have a household survey, or even if it's an individual survey, you ask people about who they live with and you get information on that, which very much limits not just theoretically what is the core family unit in people's lives, but empirically, what can we even look at? Now, we've had a lot of developments and great work, you know, alongside all of this throughout time. And we know that people like Patricia Hill Collins have done great theoretical work, really pushing us to think about families and how critical race theory, feminist perspective, intersectional kinds of approaches are important in thinking about what families are, how they operate, the effects they have on individuals. And in demography, there are too many people to list who gets connected with a family complexity approach. A lot of people in this room actually are at this center, and thinking about things like multi-partnered fertility. And so that you can't just consider, again, people in a household or even sort of people who at that moment are in a relationship together and their kids. There are other people involved, other kids involved in across households. And so I also want to acknowledge there are great ethnographic studies on families, and they've been better at kind of handling some of the complexity that comes in around different types of family and backgrounds and cultures that come into that, as well as family complexity and the expansion of types of families and who lives with who and that kind of thing. Also, I should say explicitly, thinking about sexuality and not just looking at heterosexual nuclear families, but that kind of expansion. And so my question for years in my head has been, how do we take those sorts of theoretical advances and also apply them to our survey data analyses? So if we have future studies coming out that are a cohort study that wants to emphasize family context and the importance of it, or we used to have the National Survey of Families and Households. We still sort of have National Survey of Family Growth. So there have been these major studies that are trying to focus on family life. If we have more of those coming in the future, what kinds of approaches can we think about to better capture family? And here's just a slide showing a typical household roster in a survey. It's a survey done regularly in Nebraska. I just thought it was a good visual image. So this is common in different kinds of surveys where you'll list who are the people you live with, and you'll get initials or something, and then here we have age, date of birth, and sex. So kind of demographics, you have a sense of who's in a person's household, and we have relationship to the respondent. So you may get something about kind of roles and ties and that kind of thing, but pretty basic. I've said a lot of what the rest of this says. I'll just add that in addition to what we commonly get, a sort of list of people and who they are and what they do, sometimes we also have measures of relationship quality that tends to be focused on intimate partnerships. So marriages or cohabiting partners often get asked, how well do you get along? Or how often do you fight? That kind of thing. Also parent-child relationships. Often there's a focal child in a study and you get more kind of qualitative information about the quality of those ties, but those, I'd say it's often limited to partners or parent-child, not siblings or other kinds of people in the family. Unless occasionally you get global measures where people get asked, how well do people in your family get along? Or how often do people in your family fight? And it is some kind of information, but as we all know, families are complicated. So I don't know about you, but I have people I get along well with and people who I don't get along well with. So what am I doing? Am I like thinking of an average when I answer that question? Or am I prioritizing the good things or the bad things? So how could we maybe get some more information that is specific to the different types of people and the different kinds of relationships in families? Limits, we may be missing family members in other households. And I've said most of these other things here, so I'm just ahead in the interest of time and say, so my thinking about this over time developed into, hey, what about social network methods? This gives us an opportunity to have people define who's in their family. We don't have to limit to the households. They can tell us who's important to them. And then we can follow up and ask questions about everyone on the list and get more of a sense of kind of who's there, how do they connect to other people, and what are those ties like, and what kinds of support or stress is operating through those ties. There is some work out there. Eric Widmer in Switzerland has a book on what he calls the family network method, where he's doing this, he and his colleagues. Their studies tend to be kind of smaller and, well, maybe similar to what I'm going to present today, but today is a pilot. And I hope someday we could spread this to a larger end study. And he and his colleagues often are very focused on specific populations. So maybe families with a child with autism, or, you know, kind of very specific, not necessarily general population kinds of samples. And so we borrowed a lot from what they do and the questionnaires they use and so on, but are trying to do some of our own innovation as well. And then theoretically, back to Burgess and the family as a unity of interacting personalities, I'm saying, how can we better capture those dynamics? And to me, that actually lines up pretty well with some other theoretical traditions in sociology and beyond. So social network theories that are specifically focused on sort of mapping out ties and what are the structure of those ties, strong ties, weak ties, or structural holes in those kinds of, you know, what is happening in the network. Also related and somewhat overlapping with a relational sociology perspective, which tries to really push to say, let's not always have an individual level focus on sort of people's characteristics associated with people's outcomes, but actually that people's lives are constructed out of relationship with other people, other institutions, and so on. And that ideas from that also work well to integrate into the theoretical framework that we're trying to develop for this kind of work. So this all leads to the development of the Family Matters study. And then the research questions that I will focus on today. One is, how do pregnant people self-define their family networks? Thinking about how many people do they tell us are in their family? What types of people are they? And also, who might we be missing the way we asked it? And second, what can a family network approach tell us about families? So I'll give you some descriptives to just sort of see like, oh, this is interesting. Here's what we find out when we ask it this way. Third, and it'll probably be quick depending on how we're doing on time, is I'll preview some sort of basic results on today we'll focus on prenatal distress. I may be able to mention something about depressive symptoms, but some characteristics of these networks related to distress during pregnancy. All right, so the study itself is the Family Matters study was funded by an R21 grant from NICHD, and the money arrived in March of 2020. Guess what else happened in March of 2020? So it has been a long thing, project in the works for a while, and we had to deal with things because the original plan was to recruit pregnant people in prenatal clinics coming in for appointments. And, I don't know if you remember, but clinics sort of shut down for a long time. And even when they opened, they weren't letting researchers in. It was sort of whoever had an appointment and nobody else can come through the doors. So we really had to adapt and figure out, we were going to recruit pregnant people who came for appointments and were willing to participate in the study. And at that point, we did work with a team for a while who we got access to through John Thorpe, who's also a fellow at CPC. He was very helpful. And he had a team, he and some others have a team of nurse researchers. So they're nurses that they work a lot on research projects and recruiting. So they're very familiar with how to approach and consent and so on. So they were going to be doing that. And we were hoping to have interviewers in the clinic in a separate little space where they do this often and they can do their interview and then be on their way, or we could arrange it later or whatever. But that just really didn't work in the COVID world. So we shifted to doing virtual survey interviews on Zoom. So we still had those nurse researchers recruiting for us in clinics locally in the Triangle area. And so they would recruit and consent, and we had a way of collecting contact information. We had a whole team on the UNC side, some people might be in the room, of quickly then taking whoever had consented and trying to get in touch with them to schedule and to have an interviewer themselves schedule a time to meet up on Zoom and do the interview. That went a lot slower than we wanted it to. And we weren't getting a very diverse sample. So as you'll see in the numbers, still the sample ended up being highly educated and sort of advantaged socioeconomically, but it was really tilted that way initially through this sort of recruiting in clinics locally, not surprisingly. And so we said, what else can we do? We got permission to, in this one healthcare organization that we are working with, to be able to get a list of everyone who had a prenatal appointment in the coming week. I think we ended up getting them about once a month, actually, lists of people who had appointments. And so we started mailing letters to anyone who had an upcoming prenatal appointment with information about how they could get in touch with us to let us know they were interested. And I was I thought no one would open their mail or respond to it. In the end, just sort of general response rates, we had about a 16% response rate in clinics in terms of just who was approached initially and then getting them all the way to set up an appointment and do the interview. And it was 5% from the mail. So all the letters went out. Of those, 5% of people completed an interview. We can talk more in Q&A about what that means. But this whole study was a mishmash of trying to try different things out to see, would this work long-term, right? Feasibility study. So that was part of it, is saying if we wanted to, the reason we wanted to recruit in health programs, I'm thinking of the words, was to be able to then get access to their electronic medical records with their permission, but to use that as a kind of data as well. So the idea was, can we do this well? Can we get a good sample out of this? We weren't shooting to be representative in this pilot. We just kind of wanted to see, like, who responds to this, who doesn't, what kind of respondents do we end up with? And so through clinic recruitment and mail, we got our participants. They were interviewed on Zoom. We trained interviewers here at UNC, and they did the interviews on Zoom. We used EgoWeb 2.0, which is a freely available network-based survey software program that you can program questionnaires in, and you'll see some examples of screenshots in a second. And so here's a sense of the sample demographics. So 67% have a 4-year degree or higher, 58% own or are buying a home, 33% rent. But there are 28% on Medicaid or have no health insurance. So again, you can see from these numbers, it skews towards more socioeconomically advantaged than you would expect in the general population in North Carolina. But there's variance. So we're pleased that at least we'll be able to do some comparing across categories. And then also 2 other components of the study. So one is that a subset of those who did the survey were invited and agreed to do a follow-up immediately. So the survey ended and they were given a set of open-ended questions. And I'll talk in a second about what those were. That lasted about 20 minutes. I would say the surveys, I'm not sure we've looked exactly at an average time for those, but probably around 40 minutes for the survey part and then 20 minutes for the semi-structured follow-up. And I mentioned the electronic medical records. We've gathered a bunch of those and we're still in the process of figuring out what to do with them, how to clean, code, merge them with what we have. The 2 main outcomes that we know we want to look at are hypertension, and we'll be using a variety of methods to bring in data on blood pressure, hypertension diagnoses, and potentially medications for hypertension. And then C-section delivery, because we know there's social inequalities in who gets emergency C-sections. So we'll want to try to look at that as an outcome. Okay, so here's what EgoWeb looks like. There's 2 screen shares here. So we had a series of name generators at the start of the interview, which is common for a social network interview. We said, to start, I'd like to ask you about who is a part of your family. Who are the people you consider to be significant living family members? This may include family members who sometimes make you angry or upset. They could be any age, related to you or not related to you. You may be connected to them by children you have. So we wanted this to be really open because part of the point of the study is what would people even give us? But there is also this tendency of thinking there are things we do want to know about families and we want to make sure they understand that we want to know those. So we did try to put in some guidance, which means we wanted to make sure these weren't just all the people that you were really close and had positive interactions with, but that we got other types of family members. Also that it was okay to say people who weren't related to you by blood or marriage, for example. And then the final thing, you may be connected to them by children you have. We were hoping to get some of this multi-partner fertility. We did not get a lot of that. So that's one question, is how could we do better at that? And so they give the names or initials, and as the interviewer put them in the little box here, they would populate as a list of who's in your family. So they could kind of check that. And then a whole series of questions then comes that has that list pop up in the screen. So like, who on this list currently lives with you at least 1 night a week? And the participant could just say, and the interviewer could just check who that was. So it's much more efficient than if you used a standard software. You might end up having to sort of have a question for each person. Like, do you live with this person? Do you live with this person? Right. And then after that family name generator, we had a household name generator, because a lot of what we want to do eventually is compare what would we have gotten with a typical survey that would have given us who's in the household versus doing it this way. So I wanted to make sure we didn't miss anyone who wasn't nominated as a family member, but did actually live in the household. So that's what this is trying to pick up. Then I wanted to make sure we didn't miss any children. So we then follow up to basically say, are there any other children in your life that weren't mentioned either as family members in the original name generator or as household members in the second one? A little bit more about the open-ended interviews. We use sort of a flexible quota sampling strategy. For both the survey part and the interview part, we are constantly checking demographics of who's participating and at certain points pushing harder on certain demographic categories, especially people with lower education and people who lived in rural areas. The semi-structured interview guide had a few questions, and it was fairly structured. We wanted interviews to get through these particular questions. They could ask them in any way. They were open-ended. But first we asked, who did you consider naming in the family network generator? We didn't say it that way, but when we asked you who was in your family, who did you think about, but you didn't put them on the list, to try to get these near misses of who they were thinking but deciding to exclude. Then we also went through systematically to say if they hadn't mentioned a parent figure, if they hadn't mentioned siblings, if they hadn't mentioned, certain type of family relationships, to say, is there anyone that fits that category, living or not? If so, why did they not end up on the list? Kind of probing that. And finally, we had a couple of general questions to just get at helpful and harmful aspects of their family in their opinion, to see if we would discover anything new about families during pregnancy that maybe we didn't already have measured in our survey, again, for future looking at like what's important to people about their families. We had transcripts that were automatically produced by Zoom for the survey. Actually, we didn't produce the transcripts for the survey part, but we recorded the whole interview for everyone. And so the follow-up part, we have qualitative data that come from those transcripts. They were pretty good, the automatic ones, but we had research assistants go through each transcript, listening to the interview, reading the transcript at the same time to catch errors and fix them, and make everything clear and format a little better and that kind of thing. We de-identified all the transcripts as much as we could, especially from names of people and places. And then once we had those transcripts, we now have them in Deduce, where we analyze them, which started as a process of the team reading these transcripts over and over again in an open sort of way, meeting to talk about them, kind of writing up memos, to think about what are the themes that we're seeing and what would be important to capture in a systematic coding effort. So we produced a code book, and then research assistants went through every transcript to look for text that lined up with various codes to be able to tag them, so that now it's easier to go into the transcript and look for particular kinds of conversation. Here's just a visual to think about a respondent running through all of those name generators and the open-ended interview if they were part of that. So this is a sample respondent who, when asked who's in their family, gave us 3 children. And then, but who else is in the household? Turns out there's a former partner in the household, but they weren't listed as family. And then other children brought in 2 stepchildren that hadn't been either in the family or in the household. And then the open-ended follow-up, where they start to get asked about other people they didn't mention, brings in mother, father, stepfather, brother, ex-boyfriend, boyfriend. And so as these kind of people come up in the interview, we also ask some questions about them and how they get along, to get a sense of who we're missing through the network name generator. And then for anyone who did come in through the family name generator, we have a lot of information, including the relationship to ego or the respondent, so the type of family tie, which one, if any, is another parent to the child who will be born. Do they live in the same household? If not, what's the travel time to get together? Frequency of interaction, how well they get along. I have stars by those 2 because those are the only 2 questions that we also asked the respondent to tell us about interaction and getting along for all the ties. So let's say they mentioned a mother and a father, then we're asking, well, how often do mom and dad interact? How well do they get along? So we have that for all the ties. But the other information about ties is just about ego to an alter, not for the whole network and all the ties, right? So the other kind of, some of them are bidirectional. So we ask about emotional support, instrumental or material support, like giving money, informational. support, which is giving advice about pregnancy. And we also ask about the equity if they are both giving and receiving support from someone. We ask like who gives more or less, or is it equal? We asked about stress. So who on this list annoys you? Who on this list do you think is annoyed by you? Anger, how upsetting are these people to you and how unpredictable are they? We have this question I can't wait to think and get in and figure out how to use, which is for every person, how did they react when you told them you were pregnant? And then basic demographics for all the alters, as well as a question about their overall health from the perspective of the respondent. Again, their tobacco use, e-cigarettes, drug use, alcohol use. And then the survey also included a lot of standard questions for an individual survey about the respondent, right? So their own demographics and things. And some, you know, mental health measures and. All right, so some results. How do pregnant people self-define their family networks? Here's a histogram that's showing just how many people get nominated in that family name generator. So the mean, medium, mode are all around 7. You can see the highest bars here are 5, 6, and 7. So we're getting about 5, 6, or 7 people, but you know, a range. And it ends at 15 because that's where we limited it. We didn't tell them, but if they got to a 15th person, then we said, okay, thanks, we're gonna stop there. Go on. So it's sort of artificially high there just because it includes who knows how high up they would have gone. I also wanted to show you this for family members 14 and over, because for a lot of the measures that I'm going to show you, we only asked questions, especially about like, would they give you money or not, or things that didn't seem appropriate for younger children. We limited to alters that were 14 and over. It's a very similar looking distribution. The mean, median, and mode are slightly less than for all family members. So who did we get? Here, this table is showing family alter types. And then, so the percent of respondents who listed a spouse, at least, well, spouse and partner is obvious, but the rest, at least one of these, the percent that listed them. So, and then the second column is the percent of all the alters in a type that are reported as co-resident. So 80% of these respondents reported a spouse in their family. 14% reported a partner. Of the partners that were reported, 86% were co-resident. So we can do a pretty standard sort of marital status, living arrangement kind of family structure variable, right, of married or not, cohabiting partner or non-cohabiting partner, or don't have a partner, some don't. Only 3% of participants reported stepchildren in the family. Remember, they might have come through the other child generator or in the household, perhaps. 88% gave a bio or adoptive parent, 72% a sibling. So pretty high reports of natal family. And then 11% report a step parent, 48% an in-law, a parent-in-law. We also have spouse or partner siblings, 34%. So pretty decent amount reporting not just sort of nuclear in the household partner children situation, but natal family members and in-law family members. And then you get other kind of extended kin. This includes aunts, uncles, grandparents, etc. 35% listed at least one of those. 14% listed at least one formerly related kin. So used to be an in-law. And social or fictive kin, 10% of people listed someone who wasn't related through blood or marriage or a intimate relationship. So these tended to be friends and godparents. Who's in the household but not listed as a family alter? So 8% or 33 of our 412 respondents listed household members that weren't named in the family name generator. So to a large extent, people in the household end up in the family through a family name generator. who this tended to be is actually a lot of young children. So we could see, and you'll see throughout the other results, people struggled with, do I list my small child as part of a significant family member or not? So some of the, it depends how you're thinking about it, right? Like, are they contributing to the household? Are they, so it's definitely a lesson learned for thinking about, like, if we really mean to capture them, we have to make that very clear in the family name generator. Extended family come in here, and unrelated people like roommates, right? Are children missed with family name generator? I just talked about that a bit. So here, this is using both the household and the child name generators to see, like, who are the children that don't end up in the family. And so the blue is biological or adoptive, again, towards the younger end. And the red is stepchild or child of spouse or partner. So a bit more of an age spread there. A lot of these are likely to be non-resident, but it gives you a sense of ages of children and types and who's not of those children who aren't reported in the family network. Other potentially missed family members. So this comes out of the open-ended follow-up. So 96% of respondents or participants in this part of the interview named at least one person who they thought about but didn't put into the family network. The range was 0 to 40. So all of our very good probing developed a lot of, like, oh yeah, and they're so-and-so. And actually some of them said, oh, I totally forgot about Aunt whoever, right? So we did learn also, like, who would they have actually gone back and put in. And then the median was 4. The two most common types that come up through this probing of other people are fictive kin. So people struggling to say, like, well, we're not related. Are they really family or not? They seem like family, but that affects who's willing to say in a survey interview, is this a family member? And then other family, blood or marriage related, like extended kin and so on. And so I have a few quotes to show you this limited qualitative peek here, but there were 3 main reasons we saw for exclusions in talking about these different people. First of all, just the household framework, right? So someone said, I decided when I think of family, I think of the nuclear family, like the family that you come from, the family you created at home or grew up in the same home as. So that's why I didn't list my step siblings or my aunts or my cousins. Again, very, just like demographers, maybe very focused on households. Then second, our families don't live close by. So our friends are kind of like that surrogate nearby family who can help and step up if we ever need anything, to drive somewhere, to borrow something, to bring a meal, share a meal, hang out, just be like everyday kind of support. So we heard this a lot, that I thought about mentioning them, certain family members, but they don't live that close by and we don't do a lot of things. So they are really thinking about these activated ties and what's provided there. Third, one of the more surprising to me and interesting and something I want to think a lot more about, we got a lot of stories through that probing about who didn't get listed about family estrangement. So this person says that I feel like my sister and the younger older brother, it was just like I was a hot mess in my late teens, early 20s, like I dropped out of high school and stuff. So I feel like there was just like me being such a train wreck at the time. She laughs. Kind of drove a wedge between things and they just kind of gave up on me. That's just kind of at least my interpretation of it. I sort of left the speech patterns here to see just how kind of uncomfortable and so reading these things in the interviews, you realize, I mean, they just kind of gave up on me. This has to have an effect on mental health, but we're not capturing these people. And when I stop and think about the literature on families and health, again, the way we collect data, we're often picking up people who are involved in people's lives, both positive and negative, but we aren't necessarily picking up people that are fully estranged. And they use a lot of language in the interviews about, I drew boundaries. I don't talk to that person. So clearly they're not classified a lot of times in our research as family members, but they have an effect. So we need to think about this. What can a family network approach tell us about families? So in this table, The first column is the proportion of all family members on average in a person's family network that have these characteristics. Then the second and third columns, we divide it into co-resident parts of a family and non-resident parts of a family, just to see how do those differ a little bit. Again, this sort of very early, very descriptive, but so like proportion female in the whole family network, it's pretty 50-50, but the co-resident tends to be lower female, probably because, you know, there's a lot of smaller families in there that maybe just have a spouse partner, maybe one other child. I think it was like 60-ish% of participants, this is going to be their first biological child. So they didn't have other children to report, or biological or adoptive children. Live with 1 hour of the respondent, basically 0.6 proportion, interacted within the past 3 months. That's pretty high. So another thing we're finding here is we can't always apply kind of typical network methods to family networks because there's not a lot of variance. Everyone gets along or everyone sees each other all the time, those kinds of measures. R perceives would give her material support or a helping hand. That's kind of interesting, a little bit higher in non-resident family members and residents. So this is a case where you go, okay, well, if we're only looking at households, we're missing certain types of material support coming to these respondents. Emotional support is more balanced, although would give emotional support seems to be going more to household or family members outside the household. And then annoy, can't remember what the interesting one here, I guess. We're more often annoyed by people outside our household, maybe it's higher for non-residential family. But then respondents tend to perceive that people inside the household are more annoyed by them. And so just kind of some interesting, when we talk about the informational support or pregnancy advice, we actually created these measures so that it's, did they give you advice? And then there's another question about how satisfied you are. So in these analyses right now, we limit it to, it was satisfactory advice. But we'll be looking later at non-satisfactory advice. And then just to get a peek at how family network characteristics relate to mental health, I'll show you our results for prenatal distress. Here are the questions in the survey. At this point in your pregnancy, are you feeling very, a little, or not at all worried about? And there's things about caring for the baby, medical care, the health of the baby, labor and delivery, clothes, working at a job afterwards, that kind of thing. And we averaged this out. We also have the CESD-10. And so we've been looking at depression symptoms as well. These are basic descriptives. I'll go through everything, but I just want to point out we do have what we look at in terms of social network measures here. So density and global transitivity are both measures of connectedness of the people in the network. And there we're using those two questions I brought up earlier. How often do you interact, and how, not you, like for them, for all the different ties, how often do they interact? How close are they? And what I mentioned earlier, since interaction and closeness is common, we restricted when we created these so that it's actually density of frequent positive ties and transitivity of frequent positive ties. Then we have number of components of frequent positive to check in on sort of fragmentation. Are there ways in which family networks have these separate, like these people get along and interact, but these other people over here don't interact with the other group, that kind of thing. Again, the support and stress measures, prenatal distress and depression. Sorry, we can come back if you have questions about those. Just some basic results from OLS regression here. Models 1, 2, and 3, again, are looking at those sort of global network measures. And so density and transitivity are negative and statistically significant. So the more dense and the higher transitivity, the lower prenatal distress. then number of components, if that's higher, so more fragmentation means higher distress in pregnancy. Emotional, instrumental, and informational support. Here I put them all in one model. If you look at them separately, they're all statistically significant, but when you put them in the same model, and we're going to be exploring because they are correlated with each other, like around 0.6 correlation, kind of teasing out like how do we want to look at these different types of support. And then stress, you'll see the higher proportion of people that annoy the respondent raises distress, anger raises distress, if they're upsetting, and if they're unpredictable raises distress. And those mostly all stay statistically significant in the same model. They are also similar size and significance on their own. I'll just quickly say, if you look at depression, interestingly, annoy and anger doesn't play as much of a role, but upsetting and unpredictable are highly correlated with reports of depressive symptoms. And of course, this is just one point in time. Can't say anything really about causality here, but you could imagine things going in both directions in terms of mental health of an individual and then the kinds of dynamics happening in households or families. So concluding, I think we can capture complex family networks this way and have some really interesting types of measures to start looking at exploring more family theory than we've been able to previously, especially being able to bring in outside family members. But we really need to think more about how to really capture children the way we want to. Also probing for former partners and their ties in the family network, especially these multi-partner fertility kinds of families. And then thinking about estranged family members, because stress from those relationships has to matter. And next steps is trying to figure out what to do with all the data and to be able to capture more of the complexity gets complicated so quickly. So considering maybe some person-centered type analyses, thinking about profiles of people's networks and what those look like to, maybe you have certain types of support, but not others, or certain types of stress, but not others, that kind of thing. And then we're excited to get into the electronic medical record data to be able to look at other types of health outcomes. So I'm going to go ahead and stop there and then ask, I'd love to hear questions and comments. Yes.
Hi. Thank you for being here today. This is honestly so interesting. The first question that comes to mind is capturing networks of financial support. And you mentioned, what did you call it? Material support. And I'm wondering if you had any additional metrics for kind of measuring the financial dynamics that might also exist between household and family members, and then also how closely those financial relationships follow household and like family structures, if that makes sense.
Right. You don't have a lot of detail on what's flowing between the nodes here in the network. It's just the one basic question about material support in terms of who do you think would give support to you? Who do you think would give support to you? And it says financial support, but it also says things like give you a ride or provide childcare. So it's not just economic support. And then of the alters, if I'm remembering correctly, we would have their education level, I think, but not like income or whatever. So clearly we had to make some choices about what we could or couldn't ask. There's clearly some thinking to be done about, in this case, where we're just looking at ego-centered networks and we're just talking to ego, like what can you reliably ask about these kinds of things? But I see your point, like this would be fascinating to have more information on. Yeah,
I think and part of my question is, I guess, how would this framework capture the situation where I wouldn't consider someone part of my family, but they do support me financially? Like, I'm just thinking, I mean, I'm sure you get this question all the time. Like, there's so many ways
Yes, yes, yes. So we did include some general questions. This isn't nearly good enough either, but we did include some general questions, those kind of global questions about how supportive your friends are. And because I knew at some point we would want to kind of control, because maybe it's not happening in the family, but they're getting these things from other places. Also, I will say, I have thought about, like, in a larger application of this, one could consider first getting a larger social network and figuring out who in that is family. And then maybe a follow-up to add other family members, so that you would have all this detail as well on other important people who just don't come in as family. Yeah.
Thank you so much.
Yes.
I'll echo, like, thank you. This was like really interesting. I was thinking about like recent changes in the family structure, like thinking about like if there was a recent death in the family that was like a key support person, like someone who might be like missing that relationship, but it happened like 10 years ago. They've had time to kind of like fill in that social support versus someone who like in the last year maybe like lost a parent, and how that kind of would, like, if you given thought of like if that is being captured at all, or like on how that could influence.
Yeah, it's not being captured in the survey, but we did ask questions in the open-ended follow-up when people mentioned people that could have been on the list that weren't. Occasionally, I saw discussions in there of, well, recently my grandmother died. She would have been on the list. And so I think we could use that data to get at what are some of the reasons, because we did ask also about like changes in your family recently. So that would tell us a lot about these kinds of things and how significant they were, meaning did they bring them up in the interview to start to get at some of that? But that's a good point about like knowing just what about last week? Was the family different? This is the hard thing about networks, right? Like you ask at one point and you wish you had like every day who's in your family. Yeah.
And appreciate you taking the pains to get into the complexity of the family influences. And most of the scholars be scared of it, I think. And my question, do you have a sense of the relative importance of family influences you specified relative to the individual position, economic position, social position in the society, and also the self-disposition? You know, do you have a self-disposition, including the genetic disposition, not necessarily genetic? So that maybe all of those factors may be interacting with the family relationships. So what is 10% or, oh, you see, that eventually, if lots of things very small, you need extremely large data set to capture the significance.
Yeah, no, I don't think we can do that with these data, but that is a good point. And I don't know if this is exactly what you're saying, but I've been thinking just about disposition wise, like there are things about us in our lives that would lead us to give different answers to the family network. Like I'm noticing for those who have had no other children, this will be their first child. I think they are more likely, if I'm eyeballing it, to mention natal family. But if you have a child, you may have sort of shifted your thinking about family, who's in my household now, as opposed to.
But you estimate larger model, you did not present all the coefficients on most. And
Oh, the other coefficients.
yeah, much more significant, the economic and social position, the occupation, education, and income.
Not really remembering off the top of my head. A lot of them were significant, but I wouldn't want to say right now. I could go back and check later, but yeah.
Yeah, just wanted to echo everything. Really cool to see kind of the self-definition of family and exploring that. I was kind of thinking in my head how much you think people's perception of what a family is, like it kind of tied into the qualitative, but you had some people list kind of this fictive kin of people outside or considering, but do you think maybe, is there a way to get at some of the specificity if people were just reluctant to name other people outside of kind of a household or a natal family, or kind of relational family, perhaps like friends, support networks or things?
Yeah,
There
yeah.
was
I mean, you can definitely see that in the qualitative data, the struggle with
Yeah.
like trying to figure, also just them doing the work to figure out what do these researchers want?
Yeah.
What do they need? What are
Yeah.
they asking me?
Yeah.
And I will admit that's not always so clear. Families more of this term, and I was torn between this. I wanted to know what they would say. This is a general question, but also knowing, well, I need to know about parents and kids. And so I think going forward, me, given my research interests, would be maybe a little more towards the tell us about these types of family members, and then maybe expand, and then maybe give them a chance to say who else. But even doing that, then I'm suggesting to them who
Yeah.
important family members are. So there's that tension between wanting to leave it self-defined versus not miss the kind of people I'm thinking of putting in my analysis. So it's hard. Yeah.
Okay, really interesting talk. And my question is about the broader social network, and it sounds like you'd already thought about collecting some of that in
Yeah.
the future, but like interesting both theoretically and empirically. Empirically, it could be like, think about those slides with like why people excluded people. One was distance, other was a wedge.
Yeah.
It could be that they compensated then,
Yeah.
you know, by getting social support for pregnancy from close friends. And so when you look at like empirically, you're collecting, you know, data maybe on 4 close friends might sharpen the family effect, because you'll differentiate between people who have alternative support from friends and those who don't. So that if it looks like they're all alone in terms of kin, you know, whether or not they have alternative support will actually be good empirically. But then there's the interesting question, sort of, if like some of the recent egocentric collection for networks where they ask the respondent, like, do these people know each other? Would be interesting to know, like, if the friends, is that a separate pod? Or are they actually interrelated with the family network, such that you could sort of broaden the theoretical question? Like, we have a like demographer's definition for family, but other people might have a more open definition, such that some people who are like they're like family, maybe, you know, it may be rather fluid. And I think could be a real interesting theoretical contribution.
Okay. Thank you. Yeah. Erin, and then we'll go back. Yeah.
Okay, similar to that, I'd noticed that your measure of global triadic closure was larger than density, which is surprising from a network perspective.
Okay.
Because usually you would see it the other way around. So I was wondering if that was the measure from just within the people that they said were family, or like what Ted was saying, was it the larger group? Also, if they have like a separate lollipop pod.
Looks like
Answer
Jenna's
this question.
itching to answer that.
So I'm forgetting the details on this, but this surprised me as well because I haven't worked as much with ego networks, but one of them, I believe one is calculated with the ego removed from the network. Yeah, because without removing ego, you get global transitivity and density that are like pretty much equal.
Interesting.
Yeah, so transitivity is only among alters.
Okay, and so it's higher still than density, which is rather than surprising, where it's like 50% of possible connections exist, but 56% of possible closed triangles exist. So that's a very like dense interconnected group.
Let's talk about this more because I think density might also be with ego removed, but I'm forgetting now.
Okay. So yeah, I was really curious about those possible effects, if it was just family, which is why there was such that high density, or if it was also about this more fluid conception of family and interconnections.
Yeah. I mean, those measures are just of the family network that was generated, but these are good points. Thank you. The network part is very new to me, so I'm still learning what these mean and how they're calculated. Yeah.
Thank you for your talk. I was very interested on the methodological side and the motivation to sort of bring some of the like ethnographic complexity back into surveys. And to that point, I was curious, based on y'all's semi-structured interviews, was there anything y'all would change about the survey protocol going forward? Especially capturing and some of those more like tricky concepts.
Yeah. I mean, I said the one about estranged family members. I think I would try to figure out a way to feed those into the larger network. That would be a little bit tricky because then it would feel funny to ask questions about would they give you money? Because like you just told me, you don't talk to them ever. So, but trying to get a better handle on that. Off the top of my head, I'm going to keep thinking, but take one more question because we're about to run out of time. But yeah, I want to think some more about that. Yeah.
I'm going to preface it by saying I'm not a sociologist. And so in terms of implications for maternal health, there's a lot of other things going on around maternal health than just family. And I want to just, encourage you, I'm sure you're thinking about it, but the time in their prenatal care that you're interacting with them potentially has implications. The access to health, to prenatal care, even, what, if they have it, if prior stillbirths, prior maternal experiences would have affected even who's in their network. It may have affected, if they had to stillbirth previously with another partner. Anyway, just,
Yeah.
I'd love to talk to you about, sort of making sure that the other health, sort of bringing in those other beyond just family, because while family is important, there's a whole bunch of other stuff going on there.
Right. And two quick things I forgot to mention, the series of controls that we had, and we had some of that. And also just, I forgot to mention when we were recruiting, we were shooting at a window to try to get people around in their second trimester. That seemed important to what you were saying there, just to give a sense of like, it wasn't super early in the pregnancy or super late. We're trying to get in the middle. So yeah. Okay. Thank you very much, everyone.
Pretty good. I think I was recognized. I know I had it once with you and had seen it, but then I was. I mean, at least it's but I need it.
But I have to go with them. I just wanted to say
Yeah.